Hello everyone, this is Nicole Johnson-Starr with the PTSD Retreat Radio Talk Show. Today we're actually going to do our sponsor break at the beginning, and we are going to go ahead and get that going right now. Today's sponsor is Solivay.
There's a lot of things about Solivay that appeal. There's so many good things, bringing a company together, bringing people together, and being able to have a mobile phone company that you can actually bring other people together and help pay for your own cell phone bill. I mean, how exciting is that? I'm excited to share Solivay with everyone. Our fan base within NHRA drag racing. We're going to build teams with the fan base, our family, friends. Solivay literally affects everyone in such a positive way that we're going to share it with everybody. Such an exciting company. I mean, you take something such as your mobile device that you need every day and build a business off of it. My communication, everything is through a mobile device, and I have to have Solivay. I'm Aaron Oliveras, driver of the Solivay Top Alcohol Dragster, and I am Solivay.
To know more about Solivay, go to www.solivay.com/the PTSD Retreat. I'm sitting here with Dr. Elspeth Ritchie, and I'm going to let you hear from her directly about her experience, but I'm going to tell you right now, she definitely knows what she's talking about. I have been posting her information on the PTSD Retreat for, I think it was 2 years now, as she writes as a blog writer for Time Magazine online. But I'm going to go ahead and let her tell you about her experience, and then we'll continue from there.
Good evening. It's a pleasure to talk with everybody here. I joined the Army because they paid for medical school, which was a great deal, and I highly recommend that to anybody who's interested. I did it on the Health Profession Scholarship Program at George Washington here in Washington, D.C. Then I did an internship in psychiatric residency at Walter Reed and have been stationed in a number of places, including 2 in Korea, at the DoD Health Affairs, at Walter Reed, and finished my Army career with 5 years at the Army's Office of the Surgeon General, where I was in charge of mental health policy. I had 3 trips to Iraq and have visited a lot of other places. So I've had quite a good career in the Army. I find now that I have been retired from the Army, I still care a lot about soldiers and service members, and are in a position to actually be pretty vocal and talk about and advocate for the needs of our service members with post-traumatic stress disorder, traumatic brain injury, and related other injuries such as pain and disability.
And Dr. Ritchie, I'm so grateful that you're willing to do this. Thank you so much for being here, because we're going to talk about the treatment that our soldiers are receiving, soldiers currently serving and also our veterans. How would you describe the treatment overall for soldiers? Is it meeting the needs, or is it falling short? And I'm not talking just the VA, but I'm talking overall.
Overall, it is falling short. We have some great programs out there, such as a program at the NICO, which is a National Intrepid Center of Excellence in Bethesda, Maryland. And we have other terrific programs, but the sad reality is that most soldiers and other service members are not able to get to these terrific programs. I posted a blog on Time today talking about these programs as the Cadillacs, where you might have 3 to 4 weeks of intensive therapies and evidence-based therapies such as prolonged exposure and cognitive behavioral therapy. Unfortunately, most soldiers are getting the broken down Chevys of the treatment program. They're lucky to get an appointment in many places once every 3 months, and you can't do adequate therapy. The good news is that if PTSD does get good treatment, it's very highly responsive to treatment, whether it's pharmacotherapy, that means medications, or cognitive behavioral therapy, or other talking therapies. So the good news is if you catch it early and treat it, it does very well. The bad news is if you don't go for treatment or can't get the treatment, usually the symptoms stick around. This is true of most illnesses, and certainly for post-traumatic stress disorder.
Now, Would you say that some individuals are getting better treatment than others when it comes to PTSD?
Yes, absolutely. If you're lucky enough to be at one of the posts with a really good program, such as they've got at Fort Bliss, the Warrior Resiliency Program, or they've got a traumatic brain injury program at Fort Campbell, or again here at the new Walter Reed, then you will probably get great treatment. But if you're at another installation which doesn't have one of these fancy programs, you probably won't. And there's a background behind this. It's not that anybody's trying to cheat soldiers out of treatment. Congress gave the Department of Defense a lot of money over the last 6 years or so to stand up programs, and they've done that, but the programs are not yet comprehensive and universal across the military. There's another piece of it, too, which is important. Soldiers don't like to ask for help, and if there's barriers to care, if there's a reason to avoid getting help, often soldiers, and when I say soldiers, I really mean all service members, if they can avoid appearing weak or vulnerable, they'll do so. So sometimes there are programs available and soldiers don't go to them. That's why it's important to emphasize that these programs do work. They're very effective for treating post-traumatic stress disorder, but they both have to be available and the soldiers have to be willing to go.
Now, you bring up about being willing to go and the different programs. Now, there's lots of different programs. Could you provide some of the, the different treatments, give a list of some of the treatments that are available for soldiers that they can use? I know there's apps online. We've got CBT, PE, BCT. What are some of the treatments that you recommend for soldiers and their families?
I will, and just to make sure we don't confuse our audience with too many acronyms, I'll try to be acronym free. So prolonged exposure, which you mentioned, PE, is one of the evidence-based treatments. By that it means that there's research trials that have concluded that yes, it's effective. Another one is cognitive processing therapy, we call CPT. A related one is cognitive behavioral therapy. Medications are proven effective. There's only 2 that have been FDA, Food and Drug Administration, approved for post-traumatic stress disorder, and that's paroxetine or Paxil or sertraline or Zoloft. But there's a lot of other medications that have been used. They simply aren't yet FDA approved. So those are kind of the tried and true treatments: prolonged exposure, cognitive processing therapy, and medication. There's a lot of other therapies out there that aren't yet proven that are very promising. I'm very interested in complementary and alternative medicine, things like acupuncture. There's more and more evidence that it works for post-traumatic stress disorder as well as pain. Some of these programs are using a lot of combinations of medication and therapy and things like meditation. So medication and meditation, or Tai Chi or Reiki, but these are not yet proved. It is critically important, though, that providers, both military and civilian, know how to do the proven therapies, the pharmacotherapy, the prolonged exposure, the cognitive processing therapy. There's a lot of trainings out there that are available. You can go online and Google, and the National Center for Post-Traumatic Stress Disorder and the Defense Center of Excellence has a lot of these trainings out there, usually free, usually online, but providers have to be willing to go out and find the trainings and do the work that it takes to become proficient.
Are you familiar with EFT or emotional freedom techniques, or EMDR, any of these?
EMDR is eye movement desensitization reprocessing. I'm certainly familiar with that. That actually is evidence-based treatment. I have not done that myself. I'm not proficient in it, but a lot of other people are. And it is a recommended therapy for post-traumatic stress disorder. The other one you mentioned, repeat the name again?
EFT, or emotional freedom techniques.
I'm not familiar with that one, so I can't speak to that. But again, there's a lot of new promising therapies, some of which have some support and some which don't have much support.
Are we seeing the government move more towards these alternative methods to, I want to say, support treatments, outside of coming into the government facilities to do their counseling? Are they encouraging the soldiers to seek out these alternative methods?
Let me break your question into 2 parts. One is the government doing complementary and alternative therapies? And the answer is yes. but not in all places and all times. The other question is the government referring people out to other care, either the TRICARE network or Military One Source? And the answer is yes, too. But a lot of the civilian providers out there are not familiar with complementary and alternative therapy, so it's a slightly different. The good thing about being a service member is a lot of places are trying complementary and alternative medicine, and they don't have to worry about billing insurers or applying for Medicaid. And so, for example, at the National Intrepid Center of Excellence, they've got some really cool new therapies, including one of my favorites, which is working with service animals, which helps decrease the PTSD symptoms in soldiers who are helping either have a service animal or training other service animals. So there's some neat stuff being done, and I'm putting together a series of articles. Oasis is another program in San Diego at Balboa, which is using a lot of alternative therapies, as is the Warrior Resilience Center down at Fort Bliss. But again, these programs aren't everywhere, and not everybody can get into them. Then the question about referring off posts, this is happening more and more. 10, 12 years ago, we didn't refer very many soldiers off posts because our resources were adequate. By our, I mean the military. I still say our when I talk about military.
You're never going to let that go. You know that.
Well, that's probably true. So now the military behavioral health system is so strained and stretched that they have to refer off posts. Unfortunately, in some cases, there's either nobody to refer to, or the people they're referring to don't know how to do therapies that really work. And that's a problem.
Now, talking about, you mentioned about the, there's a lot of training out there. Can you go into it a little bit more about how important it is that providers have training not just as a psychologist or a psychiatrist, but specifically in dealing with trauma?
Absolutely. A lot of psychologists, psychiatrists, and social workers kind of do what they call supportive therapy. They will problem solve with a patient. They'll provide support and motivation. Unfortunately, that may help in a global way, but that really doesn't help with the symptoms of post-traumatic stress disorder, which include intrusive thoughts, numbing, avoidance, hypervigilance, which means scanning the environment all the time. For those symptoms of post-traumatic stress disorder, there are some treatments that we know that work. PTSD is defined as an anxiety disorder. Actually, it's a little bit more than that, and it's being re-looked at now because it's got a mood component. It often has depression and often has anger and irritability in with it. So you have these therapies that I mentioned before, either medication or cognitive behavioral therapy or prolonged exposure, which are specific for the symptoms of PTSD and work much, much better than just supportive therapy.
Can you give some questions that folks can ask of the provider that they're looking at coming to, that would, that they can, to assist them in determining a good provider for them?
Sure. Well, you certainly can ask the provider for their qualifications. Have they studied the latest treatments in post-traumatic stress disorder? And by the way, what we knew after Vietnam was very little on how to treat PTSD. We know a lot more now. So find out if the provider's training is up to date. How often do they practice it? And different providers are comfortable with different types of modalities. I'm a psychiatrist. I'm used to medications. I do most of that. I don't do EMDR. There's other people, and a lot of social workers have gotten training in EMDR. They use it a lot and are very proficient in it. Psychologists usually do prolonged exposure or eye movement desensitization, again EMDR, or they may do cognitive behavioral therapy. A lot of these therapies can also be offered in groups, and groups can be very helpful. The complementary and alternative medicines is harder because, again, we have less hard science about how well they work. But I would certainly, if somebody who's listening is interested, I would certainly talk to your provider about, if you don't provide acupuncture, do you know somebody that does? There's not enough acupuncturists out there, so it can be hard to find somebody who does it for PTSD. They do that at the National Intrepid Center of Excellence here in Bethesda, Maryland, and they're building other NICOs in other facilities, but they're not there yet.
I look forward to that chip coming around. Folks, we're going to take a quick break so we can hear a word from our sponsor, and we'll be right back. All right, this is Nicole Johnson-Starr with the PTSD Retreat. I'm sitting here with Dr. Elspeth Ritchie. We're just going to continue on from where we were starting. We were just talking about